Two, one. Okay, my name is Samuel Dela Cruz, your student nurse educator for today. I believe we met last time. Can you please state your name and age, please?
Yeah, my name is Lloyd Dela Cruz. I'm 52 years old.
Okay, Lloyd Dela Cruz. So, pertaining to our last meeting, you explained some of your symptoms and what do you call it? Your problems with your Achilles tendon, I believe, after your surgery. And
Yes.
based on what do you call it? Based on answering the last survey that I gave you, I identified your learning needs. Uh, Starting from hyperopia, your long, what do you call it? Your farsighted, uh, DM with your or diabetes with your parents, hypertension also with your parents, but you don't have any of those. But right now you are experiencing sharp pain, swelling, lack of range of motion, and also difficulty to put pressure on your foot. You're also taking prescribed meds, which is oxycodone, 5 milligrams. You said you're applying compression and keeping the leg above the heart. And then you also have a ruptured Achilles and you just got surgery for it. And you're worried about the long-term effects as well as your family. Okay, so
Yes.
today we will be going over the the treatment plans, diet, how to prevent it next time. And for today, I named our presentation or lesson one step at a time so that because your Achilles, just one step at a time to recovery. Okay. So
Okay.
we're going to go over the anatomy and physiology of the Achilles tendon. I put heel right here, but okay, so what is the Achilles tendon? It is the strongest tendon in the body which connects the calf to the heel bone. And the function of it is very essential in every movement, such as walking, running, or jumping and climbing the stairs. And this is located at the back of the leg, which is identified in the middle of the calf until the heel. And there's also two of these, one in each leg. So what is this Achilles tendon made of? This Achilles tendon is composed of collagen and elastin, which are the main proteins in the body. I mean, collagen is the main protein in the body. And where does it get its blood and what is the nerve supply? They get blood supply from two vessels and also sensation from the sural and tibial nerve. And how long is it? This tendon is typically about 6 to 10 inches in adults. Okay. So moving on to our risk factors, we have age, which is the peak age for ruptures is 30 to 40 years old. And this is due to the microtrauma that is accumulated over the years due to repetitive stress on the Achilles tendon. And this is especially common with people who are physically active. In your case, as a working father, you said you were RN or nurse manager. I must take a lot of walking. And pertaining back to your first Achilles tear, when you were playing sports, you didn't have the same training or conditioning younger athletes had because of your responsibilities. And then now we move on to sex. Uh, Men are 5 times more likely to experience ruptures than women due to more strenuous activities and physical physical everyday activities. And we also have steroids as another risk factor because although these do reduce pain and inflammation, weakens other tendons due to the overuse of the weakened tendon, and it can also prevent further healing. Well, with weight, the higher body weight, the more force you have to give in order to walk, sprint, or jump, which then leads to faster tendon fatigue or micro damage. So, during your recovery, you may experience uh some of these injuries again, hopefully not. Uh, for one, we have tendonitis. Tendonitis is usually like due to the overuse of the area, such as like a lot of walking, jumping, or what do you call it? sprinting. Do you plan to sprint uh after your recovery or like return to any of those sports that you were doing back then?
None at the moment. No plans.
How about for your job? Do you feel like you still walk a lot, or is it just like just at the office,
Regular walking.
regular walking? Okay. And do you feel like you can well, it says over here for tendonitis, the le lack of rest and recovery. Do you feel like with your situation right now or your occupation and time management, do you feel like you could fit in a lot of rest and recovery?
Oh, yes.
Sure. Okay. And tendonitis is usually common in middle-aged people who play sports. Well, you don't have to worry about this because you're not middle-aged anymore. I'm pretty sure you're past that.
Okay.
Okay, so we have a re-rupture. Uh, these are due to recreational sports such as like you played pickleball before basketball, and then also falling from heights, and also sudden stress such as stepping into a hole.
Mhm.
Uh, this wouldn't be too much of a concern if you are consistent with physical therapy and just are and and just be cautious with like your steps because that would be very tragic to re-rupture it twice or three times. And then we have signs and symptoms of inflammation now. For number one, we have pain in the back of the leg, soreness, thickening of the tendon, and also difficulty flexing around the area. And then for a rupture, you could hear pop sounds, which I'm pretty sure you are familiar with in your last two tears, and also sharp pain, which may uh, become persistent within the recovery process. Okay, I will actually show a video indicating the Achilles tendon rupture symptoms. Let me just, are you able to see the video by chance?
No, not yet.
Not yet. Just,
I can hear it, but I don't see it.
oh my gosh. We're gonna have to edit this. All right.
Mhm.
Let's make, all right. How about now?
Yes.
All right. I'm just gonna go to the symptoms right here.
Swelling at the heels, a snapping of steroids, or having alone antibiotics, being older than 60 and taking corticosteroids, or have kidney disease, frequent use of high heels.
Oh, you don't.
Symptoms: a sudden pain and swelling at the heels, a snapping sound or sensation, difficulty walking, especially upstairs or uphill, difficulty standing on the toes or the injured leg. Diagnosis and treatment.
That's basically it. I
Thank
could
you.
send,
So,
I could send this video to you if there's any other concerns or more information that you want to pertain to. Do you feel like did you experience all of these symptoms and signs of inflammation when you were experiencing your Achilles tear? Like the thickened
yes.
tendon?
Yes. All of those symptoms.
Okay. Well, we are now moving to physical therapy techniques, which is the main purpose of this teaching.
Hmm.
And this is to alleviate pain or reduce swelling or whatever symptoms you have. And number one, we have icing the knee and elevating it, which you said you already are doing. This
Hmm.
reduces swelling and also reduces pain,
Hmm.
and also taking prescribed antibiotics or painkillers, which should reduce pain and inflammatory responses. Well, during your recovery, after your first couple weeks, you should probably like I'm pretty sure you are familiar with wearing a cast or a boot, and I will what do you call it? Encourage this more because it provides support and stability for the ankle and tendon while also walking. And also exercise, 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 exercise. This is very important because when it comes to recovery and treatment, prevents scar and tissue this prevents scar tissue from forming. So
Mhm.
what type of exercises did you experience when you were recovering from your first injury?
Just stretching your foot and your Achilles, doing the regular stretches.
Okay. And would you say those were very effective?
Yes, they were.
Okay. Okay, so we will now move on to the types of activities. Uh, so resting is very, very, very important because let's see. Resting is very important because resting such as sleep will also help your recovery go by faster and smoother if that's your goal. And wearing a cast and boot around the foot or ankle for about like 6 to 12 weeks can also help you practice walking around at home. And I don't know if your incision is drier. Is it dry already?
Yes.
Okay. Well, if it were to be moist, like let's say like you just got out of surgery, you were just discharged, avoid taking showers and proceed to sponge baths, which I assume you already did. And using crutches to around the house to do daily tasks is permissible and will also prevent putting pressure or stress on the foot. And also, while recovery, you should avoid long periods of sitting without the leg elevated because this can lead to more swelling or scar tissue forming. And then, if you are able to control the foot and ankle, and is also not taking any medications or experiencing any pain, you should be able to drive. Okay. Okay, uh, for our prevention of falling and like experiencing accidents, we have number one right here, following the weight-bearing instructions provided by the surgeon. This can be avoided by using assistive devices with caution, such as crutches, knee scooters, walkers, or boots. And I'm sure you have at least two of the, or at least three of those. And then because I was there back then. And then also home safety. Uh, when in the house and like trying to get around to do your like daily activities or chores. Like
Mhm.
you should clear your pathways, remove your rugs so you don't slip. And also if you don't have it or not or already, add support rails in the bathroom if possible. And also like keep your essentials within reach and also avoid stretching and reaching for items. And also for like cognitive awareness, uh avoid taking medications at a very high amount and also rest regular so that you could avoid exhaustion and be more aware of your surroundings and also just stay alert in general. And then we have our prognosis. You should be walking around 3 to 4 months, which is our typical goal. But for our immobilization, like with like after being discharged from surgery, you should be immobilized for about like the first week to about 2 weeks. And then this is when we move on to like gentle movement, which starts from like the second week mark to the 6th week mark. And we also have weight bearing with a boot, of course, starting from the 6 week mark to the 12th week mark. And I'm sure your physician or doctor will provide some exercises to get you to that point. And also, if you want to take a step further, we also have physical therapy or strengthening, which is 3 to 6 months. And like I said, factors affecting the timeline or like injury factors. We have age, and that's I explained that before. And then your adherence to rehab protocol. So just listen to them, like do do whatever they say in order for your rehab so everything can go smoothly. And like your willingness to recover. And this being your second time around, I'm pretty sure you don't want to experience it again. So
Mhm.
and your access to high quality physical therapy. You say you have do you think you are surrounded around some of the best doctors or equipment to get you through your rehab?
Yes.
Yes, okay. And then we're now going to move on to diet knowledge, which is very, very, very important
Hmm.
towards recovery. And one of the goals for our diet is to uh, influence tissue repair. And tissue repair is influenced by high quality protein, which supports repair and also surrounding tissues. Some of these foods can include lean meats, fish, eggs, dairy products, legumes, or plant-based protein. Oh, wait. And for our foods, we also want to reduce inflammation
Hmm.
because although inflammation is essential for like uh what do you say? Like responses or like signals to that you have an injury, too much of it can also affect recovery. And omega 3s, foods with omega 3s can further prevent that. And some of these include like fatty fish, flax seeds, walnuts, turmeric, or also ginger. And then we also have our vitamin C and collagen formation, which is also another goal that we want to reach uh when implementing a diet. And vitamin C is essential for collagen, which is also essential for tendons and also connective tissues. And some of these foods can include citrus fruits, strawberries, bell peppers, and also leafy greens. Our last goal is to what do you call it? Is to increase our calcium and also vitamin D for bone health. And this is essential for bone health and also recovery. And some of these can include fortified plant-based milk, dairy products, leafy greens, and fatty fish. And then lastly, of course, hydration, because this plays a huge role in transporting nutrients, aiding digestion, and overall just bodily functions.
Okay.
Your Achilles. And then we also have our quote. Uh, can we read it together?
Absolutely.
All right, on the
Tell
count
me
of three.
when.
1, 2, 3. He gives
He
strength
gives strength to
to
the
the
weary
weary and
and
increases the
increase the
power
power of
of
the
the
weak.
weak. Even
Even
youths
youths
grow
grow
tired and
tired and
weary,
weary,
and
and
young men
young men
stumble
stumble
and
and
fall.
fall.
But
But
those
those who
who
hope in
hope
the
in the
Lord
Lord will
will renew
renew
their
their
strength.
strength. They will
They will
soar
soar on
on
wings like
wings like
eagles.
eagles. They
They
will
will
run
run
and
and
not
not grow
grow
weary.
weary. They
They
will
will walk
walk and
and not
not
be
be
faint.
faint. Okay, so that was Isaiah chapter 40, verses 29 to 31. Okay, so after our presentation today, I'm going
Mhm.
to ask a couple of questions to see if you retain some information from the presentation. Okay, so if you don't mind, can you give at least three examples of the function of the Achilles that I mentioned before?
Oh boy.
Three functions of the Achilles.
Support.
Support, okay.
Mm-hmm. Steps for
Steps,
walking.
walking. Yeah, walking. One
Yeah.
more. One more.
One more. Daily activities like stepping over, jumping, or walking,
Yeah,
whatever.
that's good.
Yeah.
Okay. What do you what do you think are some of the factors that have affected your recovery before, or like that could also affect your recovery right now?
Fatigue,
Fatigue,
lack of exercise or
lack
lack
of
of
exercise.
stretching.
Okay.
Hmm. And then foods.
Foods, of course.
Hmm.
Okay. I'm going to ask a question. I'll give you multiple choices for it.
Okay.
So, every symptom given indicates an Achilles tear except A, pain on the back of the leg, B, thinning of the tendon, C, a pop sound, or D, difficulty flexing.
Difficulty flexing
No?
or decreasing of the tendon.
Thinning of the tendon? Yeah, yeah, yeah.
Then, yeah,
Yeah, of course. Okay.
that's the right answer, huh?
Okay. Which treatment is best for preventing scar tissue formation? A, icing the leg, B, wearing a cast or a boot, C, taking antibiotics or painkillers, or D, exercise.
Wearing a caster boot.
I will repeat the question again.
Boy.
Which treatment is best for preventing scar tissue formation?
Okay.
A, icing the leg, B, wearing a cast or a boot, C, taking antibiotics or painkillers, or D, exercise.
Exercise.
Right?
Yeah.
Nice. Okay. So, can you explain some of the reasons why we would want to like rest or sleep
So I recover.
so you recover faster and smoother? Okay.
Hmm.
Absolutely. Okay, how about for a wearing a boot?
Fatigue
Fatigue? A boot?
or accidents like slipping.
Okay. Well, yeah, that could work too. But it's also for like stability and like support of the ankle.
Yeah,
Yeah.
that's
Yeah,
what
yeah.
I meant. Yeah.
Why would we want to avoid long periods of sitting?
Oh, it weakens your foot or it you don't I forgot.
It's okay. Well, we also want to reduce our swelling whenever we
Hmm.
do, because a lack of movement, what do you call it, leads to a lot of swelling. Yeah, which is like why we want to implement lots of lack of range. What do you call it? Lots of range of motion exercises.
Hmm.
And can you enumerate some of the assistive devices commonly used in recovery?
Crutches,
I
uh
listed four. I listed four.
yeah, crutches, walker, and a leg scooter.
A leg scooter.
Yeah.
Okay, I'll give you that. And what are some of the goals that I mentioned when we are aiming? What are some of the goals that we're aiming with for our diet?
Foods rich in collagen.
Collagen, okay.
Yeah. Protein.
Protein.
Yeah, that's what I remember.
I think I forgot too. Wait. All right, so collagen. Okay, we're going here. Collagen and vitamin C formation,
Hmm.
And then you said protein,
Protein, yeah.
which is tissue repair, which can help with tissue repair. And
Yes.
reducing.
Uh-huh.
What are we reducing? And
Ah,
it starts with an I.
reducing I. I can't say it.
Omega threes can prevent inf
Injury, inflammation.
inflammation. Okay. And then calcium. Oh wait. Oh my goodness, I said it. What else? Our last goal.
Oh boy. We have you mentioned a lot of goals. I can't remember each one of them. Uh last goal for recovery. I can't remember, Sam.
Okay, well it is calcium and vitamin D for bone health.
Yes.
Okay. So that will be our lesson for today. And it was a pleasure working with you, uh, Sir Dela Cruz, or other known as Dad. And I hope everything goes well with your Achilles tendon recovery or post-surgery recovery. Is there any last questions or concerns that you have for me?
No, no. Thank you for letting me know these things.
Okay, if that's all, uh, I will conclude our meeting now. Thank you.
Thank you.
Have a great day.
Thank you. You too.